I am not going to ask you to have your video on. I know that's always really kind of can be awkward. And I understand a lot of folks are at home, and that's the beauty of being able to do a conference through Zoom now, is the whole fact that we can be at home and we can do these conferences and take breaks as we need to and kind of step away as we need to. So people are still joining, but I am going to go ahead and get it started. We're up to a good number of participants. Hopefully we'll have a few more folks join us. It is really great to see everyone here on this beautiful, beautiful Wednesday morning. So thank you for taking time out of your day to come to our 6th annual, it's hard to believe this is our 6th culturally inclusive conference that we have hosted. I appreciate everyone taking time, whether it's the whole day or part of the day, to join in and hear what we have to say and what our speakers have to say. We have a great lineup again of speakers. Just a couple of housekeeping notes. You should have an agenda that came in your email link, and or you can go to the UTC School of Nursing website and also download it from our CANDL grant page. So there's a page that has the conference information on it, and you can download the agenda there if you didn't receive it in your email. Bathroom breaks, obviously we're on Zoom, so even if you're at a real conference, when you need to go to the bathroom. We will have an official lunch break from 12 to 12:30. Again, we're on Zoom, so feel free to, if you get hungry, snack, eat, do what you will. There is a pre and post survey. I do ask that everyone will fill that out. That was also sent in your email with your registration and the Zoom link for today. It's also being posted in the chat box. So if you have any desire to earn the CEUs, those are $25. The conference itself is free, but if you want to obtain the CEUs, then you need to fill out the pre and post conference survey. And then these surveys help inform our future conferences. So it's really important as we continue to move forward with doing conferences. What do you want to see? What do you want to hear? How valuable are you finding this information? So the information you provide is so important to us. So please do fill out your pre and post conference. And Farron just popped up the web link in the chat for the conference website with the agenda and speaker bio. So thank you, Farron, for that. We're trying to stay on time. Farron will be posting private reminders to the speakers when your time is getting close. And then if you want to ask a question, if you will either raise your hand, so once the speaker is done, we'll unshare. You can either raise your hand and ask a question, or you may put it in the chat box. If you put it in the chat box, then I will read it for our presenter to answer. I think those are the main things. I want to do a huge shout out to Farron, if Farron will wave. These conferences would not be possible without her. She is truly amazing. She is the project director or project coordinator, what are you, Farron? She's my right, left hand, arm, leg, part of my head. I mean, I could not do this grant without her, that's for sure. So Farron, thank you so much for all the hard work and effort that you do every day with this grant. The other folks on our grant that I would like to thank are Leslie Morrow has been helping a lot with our simulation stuff. She's not on the grant, but Leslie, if you will wave, she's faculty and she has been a huge part of helping with our simulation things. I saw Mary Jo Blanton is here. She just recently left our grant, but she was a huge part of our grant for several years. So thanks to Mary Jo, because she's been a part of these conferences and so much a part of this grant. So Mary Jo, you don't have to wait, but thank you for what you've helped do on this grant as well. I'm trying to see who else. Faculty, is Priscilla on here? Priscilla Sims Robertson, Dr. Robertson, Sims Robertson is also on the grant, and she has been wonderful to work with as well. So thank you to all of our grant folks who help make these type things possible. The other person I want to give a huge shout out to is Roger Ling. Roger is our IT maven. And he is participating with us today. So Roger, we could not do this without you. So thank you so much for being with us all day and helping with any of our technical difficulties and our technical issues. And then also thank you to our speakers. Ray Bond is already with us for this morning. And so I'll say thank you kind of throughout our presentations to our speakers, but certainly we could not have this type of conference and this type of information for you all if we didn't have our speakers. So we really appreciate our speakers as well. Okay, so I am going to actually go ahead and kind of get started so we keep us online and on time. So like I said earlier, this is our 6th conference, consecutive year of the conference. The last couple of years we have done virtually because of COVID. We've all lived through COVID, and hopefully we're starting to come out on the other side of what our normal will be, but we are super excited to be able to have offered this conference 6 times, 6 years. That's amazing. Every year the focus has shifted just a little bit, but all topics are looking at health disparities, reducing those health disparities in Hamilton County and our surrounding counties, and then looking at what are barriers to access to care, and how can we as nurse practitioners and providers, how can we help our patients overcome those barriers and really just provide networks and connectivity for our patients and with each other so we're resources. Looking at even changing policy and looking at national, not only our local issues, but how do things that we do here in the School of Nursing impact our community, and how do those things in our community impact the state and then or the region. So in going to a national level. So just looking at that from a very small perspective being here at UTC, but then going more broadly. And then looking at the data. So we collect lots of data with this. As I said, please do the pre and post surveys. This helps inform the information that we provide for our conferences. And what are things you would like to see at future conferences? That's super important for us to have ideas and kind of know where to guide these conferences and what you all are wanting to see. These are always multidisciplinary conferences because it's a multidisciplinary problem addressing access to care and those social determinants of health that our patients are experiencing who are either in rural or urban underserved areas. Even patients who have insurance, we all see patients who may have Medicare or Medicaid, or they might have a $5,000 deductible. And so just because they have insurance doesn't necessarily mean that they can afford the medical care that's being prescribed and treatments that are being offered to them. So being cognizant of what are those barriers to healthcare for our patients, and then what type of services. Knowing where to find reduced and low-cost services for everyone, for social workers, for physical therapists, for pharmacists, for us as providers is so important. And with this grant funding, one of the things we have been able to do, and I'm going to share my screen, is to do Chattanooga Care Connector. And there we go. And so hopefully you can see this is Chattanooga Care Connector. This is, thank you, Roger, I can see you nodding your head. So this helps you find free and low cost healthcare in our Chattanooga and surrounding areas. So you can search by location, you can search by type of care, you can search by county, and you see when you hover over that link, it pulls up all of our different counties. You can search by service up here, and then this is a little bit of an about. And then we also have Spanish translation. So if you just click on, let's go to Bledsoe, because we do things in Bledsoe. We're also going to have a feedback button for this because we know services change, and I'll just pick on Ms. Bond because I know Project Access, and when I was at Volunteers in Medicine, worked with Volunteers in Medicine when we worked with Project Access very closely to receive specialized care for some of our patients. And so in knowing that and looking at what might be available in Bledsoe County, Project Access is Hamilton County, but what's in Bledsoe County that you can provide. And so knowing that we might have something about Project Access that maybe isn't correct information, or they've changed how they do something, we're hoping to have a feedback button here for our either community folks or for our community partners to be able to hit that button and say, hey, we've updated this, or we need to change this. As this is becoming more well known, also having our community partners being able to reach out to us and say, you know, we've updated this, or please change and update your website. So you can see we have the health department, and you can go to read more, and it has the services. So this site is something that it's a collective of all the different counties. You can search by service. We have lots of different services. We have older and senior care, pediatric care, It's not limited to medical care. So there's family planning, there's fitness, there's hearing, HIV testing, food, homeless services, social services, translational services, telehealth. So the goal of this website is to make sure we have a one-stop shop for all these different free and low cost services that are in our areas. So if there are things you see here that you're like, oh, wait, I live in this county and I don't see this on this website, please reach out to either Farron or myself so we can look at adding those resources to this website. And this is something we want you to share. It's a free website. We want you to share this with your patients. We want you to share this with your community members, with your churches, with your social supports and groups. So please feel free to take this information and share. Okay, so I'm stopping sharing with that now, and I'm trying to find my talking points. The joys of being online. I would have printed all this out usually. Let's see, the button, I've talked about that. Some of our speakers, past speakers and current speakers, are actually featured on that Chattanooga Care website. And the big picture today, we're looking at what are some of our local nonprofits that provide low cost, no cost access to care. So if you look at the agenda, Dr. Bond, or are you Dr. Bond? No, Ms. Bond. I couldn't remember that. I'm sorry, I apologize. Is going to be discussing project access. We have the Hamilton County Health Department is going to be presenting a panel. We have the Urban Underserved Healthcare Access. Dr. Leslie Morrow from here is going to be speaking on that and what that looks like with CHI Memorial Community Health Centers. So we're looking at all these different providers that are helping you get to this free and low cost care. We've actually, I think over the last 6 years, we started with the big umbrella of what are social determinants of health and what are barriers to care. And each year we've narrowed it in a little bit more. So again, super excited and thankful for our presenters today. The other issue, not an issue, the other thing just to remind you of, and I think Roger has taken care of this already, is please keep yourself muted throughout the conference until our presenters are done. If you want to raise your hand to ask a question, I will try to keep an eye on that and call on you. And then again, if you want to put your questions in the end after our presenter in the chat box, I will be reading those. And I think I have to scroll through my things. I think that is it. Any questions before we get started, because I'm running a few minutes early. So if you have any questions, comments, put those in chat, or if you want to raise your hand and ask a quick question. I see Farron.
Thank you, Amber, for that. And I received a private question about the Chattanooga Care Connector, and I just wanted to address it to everybody that I do have both brochures, flyers, and postcards for the Chattanooga Care Connect website that we can give to you to provide to your patients and or to provide to other providers in your office, or if you want to take some. So we'll absolutely pass those out to you. I will email you the PDF of the material and take some hard copies to you through one of our clinical site coordinators when they come to visit, especially if you have any preceptors in your office, or I can swing by with those or drop them in the mail. We have learned that these, once patients find out about them, or once a clinic finds out about them, they actually go very, very quickly, and it's very popular. We hope to sustain that. The website itself will be updated every semester with provider updates, with the help of some graduate students and possibly the public health program as well. So we want to make sure that you have copies that you can print out on your own, as well as giving you hard copies, because we realize we can't keep up with the demand of hard copies, but I'm happy to provide you with a couple hundred initially to get started. Mm-hmm. So please email me or comment in the chat if you would like some copies. Thank you.
Yes, and I also put the web link. So I did complete the pre-conference survey with that link, but then right under that is also the Chattanooga Care Connector link as well. So if that helps. And be prepared. I don't know about the rest of you, but I have actually, when we first put this out, and I can't remember, Farron, if we did this and that, or if we went on channel 12, we did one of those to promote this. And I've had folks from the community say, oh, I saw you on that, and call me and want my advice. And so it's a very thin line of, this is a service that you need to talk with your provider about. Thank you for reaching out and contacting me, but I can't make those decisions for you. So you might, I don't know, if it's your own patients, that might be good. But if you're in more of a kind of not where you're actually doing everyday patient care, that was a little interesting. So trying to be cognizant of not overstepping boundaries of my scope of practice. But okay, so we are running just a few minutes ahead of time, so I'm going to go ahead, and if no one else has any other questions or comments, like I said, I'm trying to kind of scroll back and forth between the two pages to look for raised hands. I'm going to introduce